Right now, before you take another action, I want you to pause and raise one of your hands. Hold it up and take a long, deliberate look at it. I am not talking about a brief passing glance. I mean a genuine focused examination, because over the course of the next several minutes, I am going to reveal something to you that the vast majority of people over the age of 60 have simply never been told. This is information that cardiologists utilize in their daily practice, yet they very rarely take the time to explain it to their patients. Your fingernails are quietly and continuously documenting the inner workings of your heart and your blood vessels. They have been performing this function for your entire life, silently logging data with every passing day. And if you know precisely what to search for, they can provide you with an early warning about a cardiovascular catastrophe long before it has the chance to manifest. I am Dr. Mandell, and I have devoted the bulk of my professional career to the practice of preventative cardiovascular care, with a special focus on adults over the age of 60. Throughout those years, I have observed a pattern in my clinic that genuinely troubles me time and time again. Patients arrive in my office following a heart attack or a stroke, and when I perform a thorough physical examination, I consistently find that the warning indicators were already present on their fingernails. In some cases, these signs had been visible for months or even years prior to the actual event. No one had taken notice of them. No one had ever informed these individuals about what they ought to be looking for. That pattern of oversight ends as of today. I ask that you remain with me all the way through to the conclusion of this presentation, because the final sign I am about to discuss is the one that leaves the vast majority of people utterly astonished. Before we proceed any further, I would like you to take a moment and engage in the comments section below. Type in your current age and share with us whether any member of your immediate family has ever experienced a heart attack or a stroke. Your response will help indicate the level of urgency with which you should apply the information we are about to explore. And if you find this type of educational content beneficial, I would sincerely appreciate it if you would click the like button, as that simple action genuinely assists me in extending the reach of this vital information to a larger audience of people who stand to benefit from it. In order to grasp why your fingernails carry such significant diagnostic information, it is necessary to first understand a small amount of human biology. Your nails originate from a structure known as the nail matrix, which is situated just beneath the base of each individual nail. The cells within this matrix are in a state of direct and constant communication with your bloodstream. They are fed and sustained by the tiniest blood vessels found anywhere in your body, the microscopic capillaries that run directly underneath the nail bed. And because these vessels are so extraordinarily small in diameter, they are among the very first parts of your circulatory system to exhibit signs of stress when your cardiovascular health begins to deteriorate. You can think of your nails as an active, continuously running monitor that your body has been quietly operating each and every day. After the age of 60, the significance of this monitoring becomes even more pronounced because the body's natural capacity to compensate for early-stage cardiovascular difficulties narrows considerably. During your 30s, your heart is often able to quietly work around dysfunction for a period of years without producing any visible outward changes. But once you pass the age of 60, those physiological reserves are substantially diminished. The warning signals begin to manifest earlier in the process, and your fingernails are frequently the location where those signals first become apparent. The challenge is that a standard 15-minute appointment with a physician simply does not allow for a comprehensive examination of every bodily system, and nail evaluation rarely earns a spot on the priority list unless something appears visually alarming at first glance. Therefore, the knowledge exists within the realm of medical research, but it seldom makes its way into the hands of the individual sitting at home who actually requires it. That gap in communication is precisely what I am determined to bridge for you through this presentation. The very first indicator I want to bring to your attention is a condition known as Terry's nails. This is a term that most individuals have never encountered before, but once you become familiar with it, you will find yourself examining every pair of hands you encounter through a completely different lens. Terry's nails occur when the entire surface of the nail transforms into an opaque, whitish, or extremely pale coloration, resembling frosted glass in appearance, accompanied by one distinguishing feature located at the very tip. At the far edge of the nail, there exists a narrow band of pink or reddish coloration, typically measuring only a few millimeters in width. This band at the distal edge serves as the defining characteristic that distinguishes Terry's nails from ordinary pale nails that might result from other benign causes. Now, allow me to explain why this particular sign carries such importance for your cardiovascular health. Research that has been published in the field of cardiovascular medicine has identified Terry's nails as being significantly associated with coronary artery disease, heart failure, and diabetes mellitus. One prominent study demonstrated that individuals presenting with Terry's nails exhibited an odds ratio exceeding 6 for coronary artery disease when compared to individuals without this nail finding. That figure is not a minor statistical detail to be overlooked. It represents a major and clinically relevant signal. And all of the medical conditions that have been linked to Terry's nails share one common underlying feature. They develop gradually and silently over an extended period of years before any dramatic symptoms emerge. I once treated a patient whom I will refer to as George, who came to see me at the age of 71. He had no urgent or dramatic complaints to report. He considered himself to be in reasonably good health, though he had been experiencing a bit more fatigue than usual, which he naturally attributed to the normal aging process. During the course of my physical examination, I observed that his nails appeared unusually pale, with that characteristic reddish band at the tip that I have just described. I proceeded to ask him some detailed questions, and I ordered an echocardiogram to evaluate his heart function. The results of that test revealed early-stage heart failure that had been developing for nearly 2 years without producing any obvious symptoms. I am pleased to report that George is managing very well today. He received the appropriate treatment at the optimal time, and his nails served as the entry point that opened up that critical conversation. The second sign I want to discuss is referred to as Lindsay's nails, and this particular condition has a very distinctive appearance that you will be able to recognize instantly once you know what to look for. Lindsay's nails are sometimes described as half and half nails because the nail is clearly divided into two separate and distinct zones. The half of the nail that is closest to your cuticle appears white or extremely pale in color, while the half that is nearest to the tip presents as a brownish-red hue. The line of demarcation that separates these two zones is typically quite sharp and clearly defined. Lindsay's nails have been associated in clinical research with both heart failure and with cirrhosis of the liver. These nail changes tend to emerge after the body has been subjected to sustained circulatory stress over an extended period of time. The reason I include both Terry's nails and Lindsay's nails early in this presentation is that they are both disorders of nail bed coloration that reflect the adequacy of blood flow reaching and nourishing the smallest tissues in your body. When the circulation to your fingertips becomes compromised over a prolonged period, the nail bed loses its normal healthy pinkish tone and begins to display these altered pigment patterns instead. Both of these signs are visible under ordinary daylight conditions without the need for any specialized medical equipment. If you hold your hand up under good natural lighting right now and take the time to examine each nail with care, you can check for both of these conditions in less than 30 seconds. I encourage you to do that right now while the descriptions are still fresh and clear in your mind. The third sign I want to cover is called Mises lines. These present as multiple horizontal white bands that extend across the nail, running parallel to the lunula, which is the small crescent-shaped area located at the base of your nail. Mises lines do not produce a raised texture when you pass your finger over them. You can see them quite clearly with your eyes, but you cannot feel them with your fingertip. This particular detail is one of the key features that helps to differentiate them from other types of nail ridges that may have a palpable texture. They are purely a visual signal, not a textural one. What elevates the significance of Mace's lines is the body of research that supports their clinical importance. A study that specifically examined the relationship between various nail findings and cardiovascular disease determined that Mises lines were a statistically significant predictor of heart failure, with an odds ratio approaching 6. This means that the presence of these lines in a patient made the diagnosis of heart failure substantially more probable. The physiological mechanism underlying this association is that Mises lines reflect low levels of albumin in the blood, which serves as a marker of the body being under prolonged nutritional and circulatory strain. When the heart is struggling to pump blood efficiently throughout the body, the rest of the system begins to experience the effects. I treated a patient named Margaret who came to see me at the age of 68. She was physically active, maintained a healthy weight, and genuinely felt well overall. During our visit, she mentioned, almost as an offhand comment, that she had observed some horizontal lines on her nails over the previous few months. She assumed it was probably nothing of consequence. I took a careful look and identified Mace's lines across several of her fingers. I proceeded to order a comprehensive cardiovascular workup and discovered early-stage heart failure that was entirely manageable at that point in its progression. The lines had been appearing for months prior to her visit. They were her body's way of signaling that it needed assistance. The fourth sign is referred to as Bow's lines, and this particular finding tells a very different story from the others we have discussed. Whereas most nail signs develop gradually over time and reflect chronic underlying conditions, Bow's lines appear following a specific and identifiable event. They manifest as horizontal grooves or depressions that extend across the nail plate. They occur because when the body experiences a significant physiological shock, whether that be a heart attack, cardiac surgery, a severe infection, or any other major health crisis, the nail matrix temporarily ceases production of new nail tissue. When the growth process resumes, this pause leaves a groove behind in the nail, marking the time of the event. What makes Bow's lines clinically important is their ability to reveal a past cardiac event that the patient themselves may not have even recognized as such. Silent heart attacks are far more common than the general public realizes, particularly among older adults. A patient named Harold came to see me for a concern that was entirely unrelated to his heart. During the examination, I noticed a distinct horizontal groove spanning nearly all of his fingernails. I inquired about it, and after some reflection, he recalled being quite seriously ill about 4 months earlier with what he had assumed was an unusually severe case of the flu. We conducted a series of tests and discovered that he had actually experienced a silent heart attack during that illness. His Bow's lines had narrated the story that his symptoms had failed to convey. Now, I want to shift our focus to something that you can check directly underneath the nail surface, rather than on top of it. These are known as splinter hemorrhages. They appear exactly as the name suggests, resembling tiny dark splinters or thin dark lines that run vertically beneath the nail. They are actually small collections of blood that have become trapped in the nail bed capillaries, and while a single splinter hemorrhage resulting from bumping your hand against an object is generally nothing to be concerned about, the presence of multiple unexplained splinter hemorrhages across several different fingers is a completely different matter. Classically, in medical training, unexplained splinter hemorrhages occurring across multiple nails are associated with a condition called infective endocarditis, which is an infection of the inner lining of the heart's chambers and valves. This condition develops when bacteria enter the bloodstream and attach themselves to damaged tissue within the heart. The infection leads to the formation of tiny clots that can break off and travel to distant blood vessels, including the tiny ones located in your nail bed. Infective endocarditis is a serious medical condition that demands urgent and immediate medical attention. A patient named Phyllis noticed these dark lines on several of her nails and mentioned them to me almost as an afterthought. She was subsequently diagnosed with a heart valve infection that was caught in time to be treated effectively. She later told me that she nearly did not mention the finding at all because she had assumed it was nothing significant. If this video has been helpful to you thus far, I would ask you to do one simple thing right now before we move forward. Please click the like button. It requires only a single second of your time, and it genuinely makes a meaningful difference in whether this content is able to reach other individuals who stand to benefit from it. And please stay with me, because the next two signs I'm about to present are the ones I want you to take the most seriously. The small whitish crescent shape located at the base of each nail is called the lunula. Most people regard it as nothing more than a cosmetic feature of the nail. In reality, it is the visible portion of your nail matrix, the active zone where new nail cells are being generated continuously around the clock. And the color of your lunula represents one of the most frequently overlooked diagnostic signals on the entire human body. When that color undergoes a change, it is a development worthy of your attention. Research has established that a reddish lunula is significantly associated with valvular heart disease and with congestive heart failure. A bluish or purplish lunula suggests underlying problems with oxygen delivery in the circulation, similar to the cyanosis that we observe in more advanced stages of cardiovascular disease. A lunula that has faded to near invisibility or become very pale is often a sign of anemia, and anemia is directly connected to cardiovascular strain because an anemic heart is forced to work substantially harder to compensate for the reduced oxygen carrying capacity present in the blood. All three of these color changes warrant medical evaluation. I want to share with you the story of a patient named Dorothy, who was 74 years old and contacted me after her daughter, who happened to be a nurse, noticed during a visit that the half-moon shapes on Dorothy's nails had almost entirely disappeared. Dorothy had not noticed the change herself because it had occurred so gradually over time. She had been looking at those nails every single day and had simply adjusted to the new normal without realizing that anything had shifted. Her daughter encouraged her to bring it up at her next scheduled appointment. We performed a complete blood count and a cardiovascular workup. She was found to be significantly anemic and was exhibiting early signs of cardiovascular strain. Both issues were identified and treated before anything serious had the opportunity to develop. Now, allow me to teach you a test that you can perform on yourself right at this moment using nothing more than your own two hands. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover after pressure is applied. Here is the procedure. Hold your hand up at the level of your heart. Using the thumb of your opposite hand, press firmly down on one of your fingernails for approximately 2 seconds. You will observe that the nail bed turns pale or white as the blood is temporarily pushed out of the area. Then release the pressure and begin counting quietly to yourself. In a healthy adult with normal circulation, the pink color should return to the nail bed in less than 2 seconds. If it takes 3 seconds or longer to return, and you obtain the same slow result when you test 3 or 4 different fingers, that is a meaningful indication that your microvascular circulation is sluggish. Research has established a connection between persistent slow capillary refill in older adults and reduced cardiac output, undiagnosed atrial fibrillation, and an elevated risk of stroke. I encourage you to try this test right now, before you finish watching this video. Be sure to perform it in a warm room with warm hands, so that cold temperature does not artificially distort your results. A patient named Walter tried this test one evening after learning about it, and he counted nearly 5 seconds before the color returned to his index finger. He tested his thumb next, then his middle finger, and then the fingers on his other hand. He obtained the same slow result every single time. He called my office the following morning and described precisely what he had observed. A full workup revealed undiagnosed atrial fibrillation, which is one of the most common and dangerous causes of stroke in adults over the age of 60. He was placed on appropriate medical treatment, and according to everything we know from current cardiology literature, That phone call very likely prevented a major stroke from occurring within the subsequent year. Walter had absolutely no other symptoms at the time of his discovery. Now, I want to provide you with a practical framework for how to apply all of this information in your daily life. I want you to begin today, not next week, and not at your next scheduled appointment. Take both of your hands and position them near a window where you have access to good natural daylight. Examine each nail one at a time, giving each finger your full attention. Check the color of the nail bed for any bluish, purplish, or unusual paleness. Look at the tip of each nail for that characteristic reddish band that signals Terry's nails. Look for horizontal white lines running across the nail that you can see clearly but cannot feel with your fingertip. Check for any deep horizontal grooves that might indicate Bow's lines. Look for tiny dark lines beneath the nail surface that have appeared without any history of trauma. Examine the base of each nail for the lunula and take note of its color and size. Then perform the capillary refill test on at least 3 different fingers and count the seconds honestly and accurately. Write down your findings in a notebook or on your phone. This documentation step matters more than most people realize because these changes are slow and gradual, and human memory is notoriously unreliable over the course of months and years. A photograph of your hands taken today in natural light gives you a concrete and honest point of reference to compare against 6 months from now. If you observe one of these signs, I recommend that you mention it at your next routine medical appointment. If you see 2 or more of these signs occurring together, I advise that you do not wait for your annual checkup. Call your doctor's office this week. Describe what you have observed and ask whether you need to be evaluated sooner than originally planned. One more important point before I bring this presentation to a close. Please do not use any of this information to diagnose yourself with a medical condition. What these signs are designed to do is to give you a reason to have a specific and informed conversation with your physician. The complete clinical picture, which includes your personal history, your current medications, and any other symptoms you may be experiencing, is what ultimately produces an accurate diagnosis. Your responsibility is not to diagnose yourself. Your responsibility is to notice, to document, and to speak up about what you have observed. That is the step that most people never take, and it is precisely that step that can make all the difference in the outcome. Your nails have been positioned at the ends of your fingers for your entire life. They have been taking notes every single day about how your blood is flowing, how your heart is functioning, and what your smallest blood vessels are doing. The only element that was missing was someone to tell you how to interpret what they have been recording all along. You now possess that knowledge. Put it to use. Share this video with someone you care about, because the next person who watches this might be the very person who notices something on their own hands tonight and makes a phone call that ultimately saves their life. I look forward to seeing you in the next video.